on to the knee assessments. We're going to do this the same way that we did for the ankle. So we'll start with our active range of motion testing. So you can ask the athlete to slide their heels all the way up to their butt as far as they can. And there we can compare to see if they have the same amount of knee flexion. What we're looking for is maybe something where they can't quite get all the way up with their knee. So then we want to ask them, why can't you bring your knee all the way back? Is it painful, or you just feel that you can't do it? Then for extension, they're going to bring their legs out. And you just slide your hands behind their knees and ask them to push the backs of their knees into your hands. And you can't really see much with most people, but you can feel, is the pressure the same on both of your hands? Then for internal and external rotation, you're going to get them to bring their knees up to about 90 degrees. Get them to raise their toes up so they're just on their heels, and point your toes inward to face each other. Okay, so that's internal rotation at the knee, and then point your toes outward, and that's external rotation at the knee. So that's all happening right at the tibia, right here. There shouldn't be that much movement. And again, you want to make sure they're not moving at the hip, and they're not moving at the ankle joint and actually going into inversion and eversion. Okay, so it needs to be a direct pivot on the heel. Then for passive range of motion testing, we're going to do the same things. So hand on the joint. I'm going to bring the leg up. Okay, I want to really stress that full flexion. Then as I come down, I like to grab underneath and full flexion, and then back. So 3 to 5 times with this hand here, feeling for any crepitus, cracking, popping, clicking, anything like that that's producing pain. Then for extension, I don't just want to come up like this and then let his leg drop, because that might be painful. So I'm going to just bring his leg out, and I'm going to pull on the distal lower leg, pull up, okay, and then see if I can hyperextend the knee at all. Then for internal and external rotation, I want to bring the leg up here. Okay, I'm going to cup the heel, and I'm going to have my hand right on the tibia. Okay, so I'm going to twist out for external rotation and then in for internal rotation. So 3 to 5 times each way. I want to feel for the quality and look for the quantity of movement. After every movement, I want to check on the other side if it's comparable, or do we have pain or reduced range of motion with one of the movements. So then for isometric testing, the first one we're going to do is testing the quadriceps, so knee extension. So I find the best way to do this is to have both knees up like this. You're going to come underneath the knee closest to you and then over to the opposite knee. Get the person to hold their leg just like this and say, "Don't let me push your leg down." So really challenge them, 3 to 5 seconds, relax. Okay, and then I would check it on the other side to see if the strength was comparable. Then for flexion, knee flexion, we're going to test the hamstrings. I'm going to put my hand here just to brace the leg. I'm going to hold just behind the ankle around the Achilles, and I'm going to say, try and bring your heel towards your butt. Okay, and I'm trying to pull away, or you could also say, don't let me pull your heel away. Relax. And that's testing hamstrings. Then for internal and external rotation, this is where we can get a bit more specific with testing the different hamstring muscles. So again, I want to bring the toes up. Maybe we'll do it on this side. I'm going to bring the toes up. Okay. When my hand goes over on this side, okay, he's going to externally rotate, which is going to specifically test biceps femoris. Okay, so press 1, 2, 3, 4, 5, relax. And then when I switch hands and he does internal rotation, go ahead, 2, 3, 4, 5. We're testing the medial hamstrings, which are semitendinosus and semimembranosus. Then for the special tests, we've got 3 different ones, I believe. So we'll start with the anterior drawer. Okay, so we're going to come up to about 90 degrees. You, as the person doing the test, you need to sit on the person's foot to make sure it doesn't move. We're going to slide our hands just behind the knee joint, so you should feel the hamstring tendons, and they need to be fairly relaxed. You're going to find the tibial tuberosity, slide just upward close to the tibial plateau. Over here, there's two little grooves. To test the anterior cruciate ligament, you're going to start by just pushing back and then pulling forward. Okay, so when you pull forward, that's testing for the integrity of the ACL ligament. Okay, if this was a positive test, you would be able to pull forward and actually see the tibia or feel the tibia coming forward towards you, which means the ACL is lax or it has been damaged. So it's not as tight as it should be. To test the PCL, we're going to do the posterior drawer test. So it's just the opposite of the anterior drawer. So we're going to start same position with our hands. I'm just going to pull forward to start and then push back forcefully. Okay, so we're testing the integrity of the posterior cruciate ligament here. And exactly the same as with the ACL, if we feel or see movement of the tibia going posteriorly, then that means we may have a problem with that ligament and it's not as tight as it needs to be. The next one we have is McMurray's test. So this is a test for a meniscal tear. It's very similar to doing a combination of our passive knee flexion and extension plus internal and external rotation. So we're going to come in the same position that we did before with the internal and external rotation. But we're going to go into full knee flexion. And I'm going to also externally rotate at the knee as we do this. We're going to do that a few times. Then we're going to internally rotate, and I'm just changing how I'm pulling at the heel. Okay, where that rotation's happening at the knee. So we're just going to go back and forth a few times, alternating, doing a few in a row. And essentially what we're trying to do is recreate the person's pain and try and catch any tear in the meniscus that there might be. You also had 3 swelling tests that we did learn. These ones are hard to do because most people don't have swelling in their knee for us to see this. But one of them was the balloting patella. So essentially, you were just pushing down on the superficial portion of the patella right here. And we're looking for any bounciness. Okay? If there's swelling in the knee, it'll appear to bounce back when we push down. Then there's the capsular fluctuation test, where you put your hands on either side of the knee joint. You push up. So if there was swelling, you'd be pushing the swelling superiorly. And then you push it down, and you just go back and forth. And as you do that, if there's enough swelling, you can see it shifting inferiorly and then superiorly. Your third one is the sweep test. Okay, so this is where you're going to sweep up the medial aspect of the knee a few times. Hold up here, so if there's any swelling, we're holding it in the suprapatellar pouch. And then we're going to slide down the lateral aspect, and if there's any swelling, we'll be able to see it filter back down through the medial aspect of the knee. So you only need to do those special tests if you suspect swelling in the knee joint. So after we've done our assessment, our special tests, there are other special tests, but not for this class. Then we would do palpation and then have a better understanding of what the injury might be.